Hi, I'm Vicki Liviakis. Welcome to Body Beautiful. This is a program where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air, and with us today we have plastic surgeon Dr. Joseph Mealy. We're talking about liposuction, and there's some big news coming out today as well. Later we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 415-561-8753. We'll also be posting the phone number to Dr. Mealy's office, so be ready to jot that down. And before we get started, any advice we give you today, certainly you'll want to consult your own physician as well. Welcome back to the program, Dr. Mealy.
Thank you. Nice to be here.
I alluded to some big news that came out today. The French government has banned certain procedures.
Yeah, the Ministry of Health in France, they started reviewing mesotherapy and a lot of these non-invasive ways to remove fat. And in April came out with a decree actually making it illegal to do most of those procedures and advising not only the practitioners but patients and estheticians alike that things like mesotherapy are considered harmful.
Okay, and that ban has gone into effect today?
Goes into effect today, and it's ironic because the French are really the folks who've started using mesotherapy 50 years ago.
Okay, the subject is liposuction, but let's talk a little bit about mesotherapy and all the alternatives to liposuction that everybody wants them to work.
Well, people have probably heard of LipoDissolve and some of the other injectable methods of trying to dissolve fat rather than having surgery. And people always worry about surgery and recovery and anesthesia. It would be very nice if we could actually have this work where you inject a little bit of a substance under the skin and the fat just melts away.
Okay, I mean, you don't just institute a ban unless there's some harm that's being done to people. Is that what's going on?
Well, the problem is it's not predictable. So, I mean, if the worst thing it does is nothing, that's bad enough. But this actually has caused harm where people have ended up with very hard lumps underneath their skin, or an unpredictable amount of fat goes away where they end up hollowed. I had a patient in my office just recently who's 20 years old, had a small amount of fat underneath her eye that would be very simple to take care of with a minor surgical procedure and in a predictable way, but instead saw someone who injected some substance in there to try and get the fat to melt. First time it didn't do anything, went back and redid it, and now she has hollow eyes and looks 30 years old. And in order to fix that, that's almost impossible.
Okay, it's one thing to have the French dealing with this, but are some of these procedures being done in the United States?
Absolutely.
And do you think that the laws will follow here as well?
Well, they may. There's certainly a big move to try and circumvent the FDA and these substances because a lot of them are under the guise of health products or supplements rather than under the purview of the FDA. But the main thing, and believe me, plastic surgeons would love to have something that actually worked predictably in that way where we didn't have to use anesthesia, we didn't have to do surgery. The reason we do liposuction is because it works, and we can make it work safely and effectively and in a predictable manner.
Okay, so the ban is an umbrella of, does that also include ultrasound?
It does. It includes every external form of fat removal. Ultrasound, not just the mesotherapy, but ultrasound, radiofrequency, infrared therapy, carboxy therapies. It's fairly wide net that they've thrown on this. They may go back and look at some of these and find out, well, we'll let that work, we'll let this work, but at this point they're all off the table, not available.
All right. For those viewers who are interested in doing a little something with their bodies, and if they don't have the, let's say, the good fortune with genes and after a lot of exercise and nothing's happening, good old-fashioned liposuction
still works. And and the other thing you'll always hear from the board-certified plastic surgeons is liposuction is not a way to lose weight. So if you're 100 pounds overweight, liposuction at most removes about 10 pounds. You're still 90 pounds overweight. I'm not sure I'm helping somebody in that situation. It works best for people who are near their ideal body weight, who have areas that are disproportionate, that are stubborn, that just aren't going away, or in order to get those areas to go away, they look emaciated in other parts of their body. It's a way to sculpture and balance the body and get rid of those areas that are disproportionate.
Okay, for those people who are familiar with liposuction, is it the same as it was, say, 10 years ago, or have advances?
In many ways. Not too long ago, we started coming up with this tumescent technique, and tumescent means we're putting fluid in before aspirating the fat out. And that fluid has some local anesthesia in there, and it also has some epinephrine, which keeps it from bleeding. And it works extremely well. And all the other new modalities that you'll hear using lasers, ultrasound, all require that technique in order for them to work.
Okay, so, and that's what I was going to ask you. So the techniques are still allowable and preferable if you can to involve laser.
The surgical techniques were not banned. So using a laser in conjunction with liposuction, with removing the fat, was not banned. Their concern was that just going in and destroying the fat cells leaves those cells behind. and that puts a toll on the kidney and the liver and the other organ bodies in the organ in order to clean that up and make it go away. With liposuction, it's vacuumed out, it's gone. The body has to deal with the injury, but not with all the dead fat cells.
All right, fascinating stuff. Thanks for keeping us apprised of all the latest and breaking news. We need to take a very quick break. For more information about Dr. Mealy, you can call him at 925-943-6353 or check him out on the web at drmealy.com or his blog, sanfranciscobreast.com. We'll be taking your phone calls and show you some before and after pictures when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.